o'clock there. Don't know if you can see that. 7 o'clock.
We're on time for the first time in ages. It must be a special night.
It must be a special night. So we are being joined by the wonderful Anoni Harper Machin, I should say.
Here she is.
Here she is. Oh my gosh. Face and neck surgeon is her handle. Go follow her.
So she needs to ask to join in.
Oh, okay. She joined.
And only at the bottom,
Go.
there's 2 people and a plus. I think if you click that, it will...
Yeah. Oh, invite to join. We can invite you,
invite
actually.
There she is. She just came up.
Yeah, I ruined it.
You did.
I'm too excited.
There she
There
is.
we go.
Invite. Oh,
We might
there's a
have
message here. Request to join. Accept. There you go.
Yeah.
Might have done it.
Well, I mean, not actually working. Oh my gosh!
I think
Hey,
hi.
you're on.
Yeah.
How are
Oh,
you?
I'm well. I realized I need to sit up a bit.
Yeah, me.
Or put myself.
Yeah,
I think
yeah, we're a
when
bit like that.
Everybody's like.
So, we don't have our normal setup. I might need to explain this. Oh, that's quite good.
Yeah, I have to hold it.
Okay, what I can do is dangle my keys behind it there.
I'm going to send a photo.
Of this setup. You wouldn't believe this.
Setup.
So
This is
we're not at home.
No.
We are in an Airbnb, as luck would have it. My dog's
We're
desperate.
on a little Easter holidays. Little Easter holidays jolly bob. So we're in Norfolk in a little tiny Airbnb. So we haven't got our normal setup.
And so what I've actually done, because it occurred to us just before we were about to come on that there was nowhere to actually put the phone without holding it for half an hour, which would be a bit tedious. So Bexy's taking a photo. So what I've done is got 3 logs out of the fireplace and I've propped them up onto the drainage tray for the washing up, which makes a great phone holder, but it wasn't the right height, so we had to put them up. So this is just genius. It's brilliant.
Love it.
So there you go.
Love the
Thank you for
enterprise.
joining us
Yeah.
today.
We don't just
No
throw this
worries.
show together.
Yeah. Sorry, I couldn't make it the last time, but yeah, it's all good.
Right.
All good, all fantastic. So I should introduce you. Anoni is a plastic surgeon. Where are you based, Anoni?
Whiston, Liverpool.
Excellent. So a bit up the road, but
Yeah.
I really hope we get to flag you down now and again.
Yeah, a bit north, and well, that's NHS and privately Chester.
Okay, okay. So a bit closer our way. Where do you live?
Just
Right, if
outside Chester.
I can ask that on a public.
Yeah, no, it's all right. Yeah, no. Like quite rural. We're quite out in the sticks. About 4 miles outside of Chester, but it's lovely because you can still get a taxi into town and a takeaway.
Nice.
Nice. So yeah,
Awesome.
so we're right on the border with North Wales and Chester, so it's lovely. Yeah, yeah.
Okay.
Nice.
So when you came down, how long did it take you to get to us when we saw you? So Anoni was demonstrating
Yes.
a surgery, and we'll talk all about that quite soon.
Yes, it was about 3 and a bit hours. So of driving. Yeah, so it's a fair old way.
Okay.
But it's not a bad drive, but it's fairly far. I'm used to driving. My sister lives in London, so I'm used to driving down to seeing her. So it's not that bad. So yeah.
So you sort of pass now and again anyway, I guess.
Yeah, and we have friends actually in Marlow. So yeah.
We
So
were in
met up
Marlow.
with.
Yeah, we were
that-
at dinner in Marlow last night.
yeah.
As it happens.
You were probably with my friends and you just didn't realize. The medical world is very, very small and they're all medics. So yeah. But
Was another
yeah.
plastic surgeon actually. So
No, but they're not plastic surgeons, I'm afraid. But yeah.
there you go.
Yeah.
So Anoni joined us. So we had a masterclass, a live surgery masterclass at Berkshire Grove Hospital on January the 27th, and there were 4 of us doing live cases, and yours was a Myellevate neck lift.
Yes.
And I say we posted one of our cases,
Yeah.
and it's just got a lot of interest. It's really. So could you tell people who don't really know anything about it what it involves?
Totally. So it is a way of adjusting your side profile and your neckline basically percutaneously without having to go through a full open neck lift and the associated scars. So it is a surgery. It does have, I call it minimally scarring. There are a few very tiny scars, but in comparison to some of the scars for a full open neck lift, it's they're invisible basically. And it uses a polyester or a permanent suture. It's the same one I use and probably you use. It's called Ethibond when it's not in the Myellevate device, to suspend the tissues of the front of the neck. So the platysma, the muscle sheet, your submandibular glands, and just lift and refine everything at the jawline. So you get a really nice snatched side profile, enhancement of your mandibular or your jawline sort of look, and then also a real like improvement in the angle between your chin and your neck, your cervicomental angle. And it's just a really nice kind of combination of surgical procedures. So it combines liposuction, placement of this permanent suture device, which is known as the Myellevate, which is what Cynosure markets, and just to really give you that neckline that you kind of want to be seeing. So no double chin, and no, as one of my wonderful patients described it, a chin neck. She's like, get rid of my check.
Yeah.
Like,
yeah.
So
yeah, it's the new cankle.
Check be gone procedure. So yeah, and I've done it on ladies ranging from 40s to 78 has been my oldest lady.
Wow.
Yeah.
Wow.
So and I do combine it in some people with skin excision.
Yeah.
So if there is a lot of lateral skin excess, I do remove it. But for the most part, in those with just those kind of complaints, they just want a more snatched jawline and sort of an enhancement in this angle. You don't have to excise skin by any means, and I would say that that's pretty much the standard.
Out of interest, in the 78-year-old, did you have to excise skin?
Yes, in her I did. Yeah.
Yeah.
So yeah, she had quite a lot of very lax skin, but then also just really wanted something done under local anesthetic, because it's all entirely done under local anesthetic, and didn't want a huge procedure. And I got her turned around in about 5 weeks because her son was getting married. So, and she had not found anything that she didn't want a GA. She didn't want anybody doing sort of anything terribly drastic. And she landed on this, and she's like, I'm so sorry, I've only just found you, and it's 5 weeks before the wedding. Can you do it? And I was like, we'll give it a go. So, yeah.
So we've got some questions that have been sent in. So one of the questions is, do you do liposuction with this procedure?
Yes. So that's key. As I say, it's kind of like a sequence of surgical steps to address all the problems in the neck. So basically, what it does is remove that submental or under the chin fat, which I'm demonstrating rather ably on this call today.
You and me both, don't worry.
And so all submental liposuction and refinement along the mandible and the jawline. And then also when you go like that, you can see my platysma bands.
Yeah.
So the we all got them, huh? And it divides those bands so that instead of the band look, you've got a nice smooth kind of appearance, which I've only ever been able to address before by doing an open platysmoplasty with a really, like, I mean, scars are scars, but it has been super ugly sometimes, that scar under the chin.
Not a scar I love, I've got to say.
No, I don't love it either. I know in the States and things that they do a reasonable amount, but I just have never really been that happy with putting a scar under somebody's chin. So so it does the fat, it does the bands, and it just suspends all that tissue up there. So yeah.
And we've had a question come in saying, what sort of aftercare is needed for this procedure? So
you are basically required to keep on a compression garment, and if you've had your bands divided, a collar for a week, as much as you can. All right.
First thing I think will surprise you is how long you stay in hospital.
Well, you just leave. Yeah, you just, like, that's it. You know, it's local. You get up
and you're off.
Cup of coffee or whatever you fancy, and you're off. And as I say, the garment is important because it just keeps everything kind of compressed while everything's healing down. And also the color is important, because if you sit with your head forward, as most of us do on laptops and iPads and things, the bands can actually re-scar back together, so you can get a similar kind of effect as it heals. But if everybody kind of stays in their garments and stuff, it's not too onerous. A lot of my ladies haven't even said that they've had surgery. They've said, oh, I've injured my neck or whatever, and people are like, oh yeah, fine. And although that is a thing, it's not too bad. And people come sort of a couple of days afterwards. Those are all removed. The wounds are all checked. The compression garments are put on, but basically you're washing as well. You can wash your hair, 24, 48 hours afterwards. And the little puncture scars to deliver the device are healed within a day or two. They don't even need a stitch. They just heal up by themselves.
Now, interesting. Have you, so we're both doing these. You've done a lot more of them than me, and you've been doing them for, when did you start doing them in the UK?
It came into the UK 2 years ago.
Yeah.
I didn't get the first bunch of training. I was in the August of that, so it's been about 1.5 years I've been doing it. Yeah.
So I went over to New Jersey to be trained on it. I mean, gosh, probably about this time last year, and it's been introduced into our practice, I mean, in the last 6 months or so. So I've done fewer than you. I haven't seen a complication, but it's early days. Have you come across an infection? Have you come across an issue?
So this is an interesting question, and I can't necessarily see who's on the call and things, because personally in my patient cohort, no. However, we are not the only people in the UK doing this Fulvio, and it speaks to sometimes knowing that your surgeon is fully qualified, is on the specialist register for plastic surgery, or an associated specialist that is doing face and neck lifting a lot of the time. And so we have had one that the rep contacted me about, which was then a fairly deep abscess in the neck that needed to be drained on the NHS, that was done elsewhere by somebody who is, believe it or not a surgeon, who still managed to get trained to do this. And this is the problem we have a little bit in the UK, is that we suffer with that, and complications happen to anyone, but it is how necessarily one would deal with that complication that makes it important. Because we all have infections, we all have scar problems, we all have issues, but what I would say is that you do need to, as a patient and as a person, do your homework. And we're very much, we've been talking about this over the last 24 hours very extensively, between BAPRAS, CAPSCO, BAPS, and it is a problem. And so, yes, I have seen it. Yes, the paper published out of the guys that the technique, they looked at 300 of their cases. They've done several thousand probably, and the infection rate is less than 1%, but it's still there. Not had any particular issues that way myself, but it is known. It's still full on surgery, and if you've got to be doing it right.
That's the important. It's surgery. It's not a thread lift. It's not an in-clinic. It is a surgical procedure, and it's a permanent stitch. And if a permanent stitch gets contaminated, you're obviously never going to eradicate it, and antibiotics won't cut it. And I think there's something to be said for being a surgeon isn't some magical kind of thing imbued on you at birth, but it does mean that you are used to, for decades, how to manage a sterile field. So we are looking at that stitch. We are used to, if it drags along anything we don't like, we'll cut the end off if it's been contaminated. We're just taking great precautions. We are super paranoid, and we prep and drape like a surgical procedure. It is a surgical procedure.
It is a surgical procedure, and you have assistants with you that help you control everything that you're doing. Certainly when I did it in your facility and in my facility, we have air handling, air management, which people won't even realize is a thing. But you go into an operating theatre as a patient, everything in that operating theatre is very carefully controlled to control infection, including the air that's going through the actual theatre. So if you're having it done somewhere that is just a room or a clinic room or surgery done like that, that is not a clean, sterile, or as good as it can be. You know, we're only as good as we can be.
Yeah.
And you know, you can definitely control that, you know, and that's why, yes, it is a surgical procedure with a permanent suture, which needs to be in a controlled kind of environment.
I will say,
Stuff. Yeah,
I'm slightly surprised because I was going to sort of credit to Cynosure because they are really trying to keep this only in the hands of people who should have it.
Yeah.
So, surgeons, plastic surgeons, you know, ear, nose, and throat, I think.
Yeah, I mean, it wouldn't have it. See, for me personally, as a professional and stuff, if you're on the register, the specialty register, you have been trained as a surgeon. You know, and it is, you have exams and training that are recognized in this country, and you have been entered into the specialist register. And if you don't, you don't, you know, and whether that's ENT, plastics, or whoever, I don't mind, but it is, I think that shows a certain level of reassurance of training that, again, as I say, I now look at everybody and say, yeah, sorry, Bex.
People how to check the specialist register.
Oh, it's super easy. You just go on to GMC, check the specialist register, and you can put in the name of whoever it is, my name, Fulvio's name, anybody that's a doctor, and what it'll come up with is the year they qualified as a doctor and where they qualified from. And then underneath that, whether they're a member of a specialist register. So for myself and Fulvio, it'll say on the specialist register for plastic surgery. For my husband, David, he's on the specialist register for orthopedic surgery. So they know that's what it is. And it's literally that quick. And you don't even have to spell the name right.
No. You can tick a box that says sounds like. And,
sounds like this.
Becky, to answer your question, yes, we are talking about the Myellevate. Myellevate. My stands for myo or muscle, so it's a muscle elevation technique. That's why they called it that. Yes, and that's what we're talking about. You can also, on this point of checking the GMC register, if someone's a specialist surgeon, just ask the doctor you're seeing for their GMC number, their General Medical Council number. They will know it. Mine is 464-5115, and it's an awful lot easier to type 464-5115 than to fumble around with 464-5115 is me, and you'll be able to rattle off yours, no doubt.
614 604.
Yeah, so we're quite happy being stalked. It's a good thing. People should know how to check. And if anyone's being a bit shady about that, you know, doctors who are offering this kind of treatment should really be proud of the training that they've had to get to that point. And if they're being at all shifty, then it's a bit of a red flag.
Yeah. Okay, another question that's been sent in is, what type of anesthesia is used during the Myellevate procedure?
So I do mine under local anesthetic, and I also so I was previously doing everything pure local anesthetic. That was it. And then, and this is, I have nothing to do with the company. They don't, but Desuvio is a long-acting sublingual opioid-based painkiller, which I have to be honest, I used for the first time during the case at your place at Berkshire Grove, and I was impressed. I was like, this is a little different. So
do you know that was the first in the UK?
I know, yeah. Like, I have subsequently ordered it off your lovely pharmacist for 4 more of my patients, and you know, it's a smoother experience. So I'm great with the chat, and when we're infiltrating, I'm talking, I'm distracting them, and it's fine. And I used to find that I would have infiltrated, and then I'd be going just a little further in the neck, and there would always be a slight pinch for them. They would always just do that a second, and you talk, you know, and it would be fine. With this, there's just none of that. It's just a very smooth, and it's you know, not too bad at all. But no, they're fully conscious, awake. you know, chatting, and it doesn't obtund their consciousness at all. But it just seems to smooth out the edges on that local anaesthetic, which is a bit pinchy. It's a bit stingy.
Yeah.
It's not, you know.
With the case that you did at Berkshire Grove Hospital, I remember the patient saying to me, I didn't think the sedation did anything, except when I realised that they kept asking me which hand I write with, and I said I'm left-handed, and I'm definitely not. I use my right hand all the time, but I kept saying I was left-handed, and I don't know why.
It's like, oh bless her, she was a superstar, and she let us film the whole thing and stuff. But I mean, you can have it under general anaesthetic if you would like to. Although I have to say, it is easier when the patient is able to turn their own head and you're looking at their contours and they're chatting to you, and I can, you know, in real time check how their nerve is, and, you know, whether they're moving their lips normally and stuff, and, you know, if they're comfortable. I mean, I suppose if they're asleep, they're always kind of comfortable, but it just is, it's a really nice, you just have chats to people and they like it, you know, it's not too bad, you know. So yeah, local. And go local.
I've got to say, I've been increasingly finding that patients are more keen to have things awake. Not everyone, but a lot are put off by the general anaesthetic. And, you know, the thought of a facelift terrifies people. A neck lift frightens them, strangely for me, a bit less than a facelift does, but a neck lift frightens people a lot as well. But the barrier, the psychological barrier to Myellevate, you know, there's no real scarring. I mean, there is scarring, but they're pinpoint scars, which I struggle to find knowing where they are. And patients are awake for it. So there's no fear of the unknown. They're there with you the whole way through. And I've just found that it's suddenly dropped the barrier to entry. That's where things like jawline fillers were working, because it was a low barrier to entry, and thread lifts were working, but they're just not as effective. This is as far as I can see, it's an incredibly long lasting procedure. I don't want to say anything's permanent.
Oh, well, I was just going to say, one of the other questions we've had is, what are the expected results and how long do they last? I think this person's thinking, is it like a thread lift?
No.
Right.
No from both.
Yeah, 5 and 7 years is what the quoted longevity of the results are. So, and that is...
Does the thread just stay there?
Always. Yep, you'll find it again. When you do redo facelifts 20 years later, you find Ethibond from 20 years prior. You know, it just stays with you. It's totally inert. And it just sits in there, and this is the same stuff. So yeah, if you went in 10 years after the fact and did an open neck lift, you'd find that stitch. So yeah, and yeah, 5 to 7 years is what they quote. So yeah,
it's interesting you say that. So obviously I don't have any 5 to 7 year cases. I was chatting to Barry DiBernardino in New Jersey, who I know you know as well. And he was saying that he's got 10-year plus cases that have persisted. So I guess we can't promise that, but it's encouraging to see.
Yeah.
If you think about it, you know, what's going to happen? The stitch is going to stay there. It's probably not, this fixation that we put at the back of the ear is so rigid.
Yeah.
As long as
anywhere. But your face ages around it, sadly.
Yeah, absolutely, absolutely. So yeah, you will get sag, but I would get
it's not the suture that's failed; it's your face.
Well, yeah, you need a bit more hoiking up than you would have done. Yeah.
But the 5 to 7 that comes from their paper, they looked at 300. That's what they had data on at the time, and on average, that's what I say to people. And by the time you're getting around to the 7 to 10 year mark, you're gonna want something else doing anyway. And that's the thing.
That's fascinating, because the Barry Jones paper, "How long does a facelift last?" came up with a full surgical facelift lasts 10 years. The neck, they were quoting something like 7 to 9 anyway. So the neck lasts as long as the face did. And the outcome was always better than it would have been but for the surgery. But at that time point, they were saying you're kind of at the same point that you were when you came for the surgery. But bear in mind, that was 10 years earlier. So it's I find this "how long does it last" question very difficult. But one thing we can emphatically say is absolutely not a thread lift. We're not saying,
It's
1 to
years.
2 years. Yeah,
Thread lift is months.
yeah,
It's months.
yeah,
And what was I going to say to you? Oftentimes as well, when somebody has or does something like this, they tend to then take a little more care on the skin and things.
yeah,
So I think then people, and certainly they recommend in the States, that you should be doing some sort of energy treatment once a year,
yeah.
making sure you're on top of your SPF and your retinol creams and that type of thing. So actually, I think people then it's it, get into the maintenance type attitude, that you've got to maintain the look. This is not going to do everything. If you have fine lines around your eyes, you're going to have to, do something about that if you want to maintain a youthful look. So yeah, I think it sort of enhances people to kind of look after their face and their skin a little more, particularly if they've had some surgery. So yeah.
But you know what? I think I'm finding that patients are a lot better educated than that, because they used to come. So back in when I was doing fellowships, and I
When
spent time
we
doing
did the Dallas rhinoplasty course together, which feels like a whole lifetime ago.
oh God, yeah.
Here.
So Dallas and London fellowships and just training. Patients used to come along having not done anything in terms of their face for decades, and they would expect to have surgery, and then that would be the panacea for all their concerns for the rest of their days. And that's not a good approach. That would get these really dramatic, kind of overdone looks in a way. And the surgeon was trying so hard to overcorrect so that they'd still be happy in 20 years' time, which is kind of impossible. And now I'm finding that patients are accepting that they will need to do some maintenance, non-surgical treatment. And the analogy that was put to me that I think is just beautiful, I think it's lovely, is you don't go out and buy a Rolls Royce and then never expect to service it.
Mm-hmm. Yeah.
And I think, yeah, maintain the radio frequency treatment, or whatever it may be, once a year, maybe twice a year. And
yeah, I think when you spend all that money on a procedure, plus accept the downtime and things like that, I think the focus, if that's a particular troublesome area, then the focus is always on that area, isn't it? It can sometimes to a different area, but look after what you've been through. You've done. Look after what you've.
And I was also going to say, we're very bad in the UK at thinking, like, quite rightly, in the States they'll say, yeah, you need your facelift, but you also need, a peel, a brow lift, your eyes done, and list off, so I have people come and they say, oh, well, you do this one thing and that will make it all better. And you're like, no, you actually need a few different things. And people pick and choose, and you can't, but that's the fact of the matter, is sometimes you see these beautiful images coming out of the States, and I do it as a surgeon. I'm like, wow, God, those results are just unreal. And then you realize how much surgery, and they've been prepping their skin with retinol for 6 months prior, this, tons and tons of stuff. And you just, compared to kind of in the UK where people are like, I just want this one thing and that will be okay. And you're like, well, not so, it'll go some way, but you probably need a wee bit more doing. But that's just it's a different attitudinal thing, really. So yeah.
Well, I think part of the reason for that, I think we're probably a decade behind the curve compared to the States. And in the States, forever, there have been independent plastic surgeon-owned clinics, and I know you have your clinic, which enables you to offer these combined treatments in a holistic approach. And we've got a Turner and latterly the hospital as well, Berkshire Grove. And, so we've baked in this integrated approach. But it's the elephant in the room is that most of these procedures, most surgeons are working in the sort of corporate hospitals and actually having access to non-surgical treatments. It's certainly not joined up. They might refer you to an
You're quite right. Yeah. And I think it's important as plastic surgeons to be on board with some of the non-surgical stuff as well, really. So
Very much.
Yeah. Sorry, Beck, I interrupted you.
interrupting, sorry. I was going to say we've had a message on a live and a message email in. Lots of people are asking about the cost. What's the typical cost? And this person has emailed in saying, will my insurance cover any part of the procedure?
Afraid not. No.
I mean, you can have a go.
Yeah, nice try.
Yeah.
I'm going to say no.
Well, I suppose, well, to be fair, there might be one exception in facial paralysis.
Yeah.
Perhaps if you were doing facelifting or neck lifting for symmetrization for a facial paralysis thing, then that would probably be a possibility, but that's a very specific kind of issue. So yeah, but no, not for cosmetic stuff. They will not cover. No.
I guess with facial palsy, they probably would be having a full-on, facelift.
Yeah.
So they'll I can't see it being this procedure for that. Maybe there might be some people. Maybe they've had a hemi facelift and they need something just for a localized area.
Yeah.
Yeah.
But no, it would be pay. With us, it's I think if you look on the website, I think it's £6,900 for a Myellevate. So for the whole procedure, and that is, you get 3 sessions of the radiofrequency microneedling. You get your surgery, your compression garments, your aftercare, and to chat to me for like 2 hours while we're doing it. What's not to like?
Priceless.
Yeah.
Absolutely priceless.
Which I have to say, compared to a neck lift, is an absolute bargain.
Definitely.
Yeah.
And actually, compared to a thread lift, is an absolute bargain.
Yes.
As well.
Threads are
they're about £3 grand, I think, depending on how many threads you get put in and stuff, and yeah. So
yeah, £3 grand for something that lasts a few months is
and you
not.
look a bit weird on threads, don't you?
I never could get over the dimples. I got trained in thread lifts. And
yeah, did you?
Actually had. Yeah, I got trained in it, and I didn't use them. And then time passed, and then the rep came and told me how amazing they were. So I got trained again, and I actually had these things in our fridge, and they expired. They cost a fortune. You've got a lot of them as a minimum order, and they actually expired because I was waiting for the unicorn Goldilocks patient to come along, who would be perfect for it. And I was looking for someone who was thin but not too thin, that they'd show the threads, and quite slack-faced with not too bad skin. And I was looking, because I wasn't going to put it in someone that I wasn't going to get a great result, and I ended up, these patients don't come very often who are really good candidates. And then when you start talking to them and you give them the pros and cons, because they do come along sometimes, and you say, yeah, but it's going to last, if we're lucky, it might last a year, and it costs this much. And
So another question we've been asked is, just wind you in.
Holding us up, okay.
How can I tell if I'm a suitable candidate for Myellevate?
Well, I suppose if you have those issues, you want to sort of refine the jawline, you have a bit of submental fullness. If you give a bit of a grimace and you have those bands going on, and you don't really like your side profile, and you're wanting something that is less invasive than a full-on neck lift, then you're probably suitable. And we certainly look at photographs. Somebody will send in a photograph and I'll sort of say, yeah, probably, yeah. If they don't want to come along, in person beforehand, and just sort of say, yes, come for a consultation. You would be suitable if that's what you're thinking about. So yeah.
Well, yeah, it's very versatile, I've got to say. But what would drive you to offer someone to recommend, to steer them towards a neck lift? If they say to you, look, I am not concerned about the downtime, I'm not concerned about a GA and a scar, I'm not concerned about an overnight stay, what would drive you to recommend to them a neck lift rather than a Myellevate, or a Myellevate rather than a neck lift?
That is a hard one, because actually one of the Spanish surgeons that was training asked me, he's like, why do you do any open neck lifting anymore? Yeah. Like, if you can do that, why would you do the open one and stuff? And I was like, well, that is a good question.
Kind of where I'm going.
Yeah. So I think it's probably that sometimes people, you describe to them the technique and they say that's not for me. And you say, well, I still, it'll still be a permanent stitch holding back, your neck tissues and your facial tissues and things. And they're like, yes, I can legislate that, but I don't want this thing running around my neck. That's the times when I've said, okay, well, neck lift, that's, we'll just go for it. So yeah, so I do find it quite a powerful technique. I want to be tentative because like it's still relatively new in the UK, and you can't say, well, I had somebody say to me, oh, little scars, little results. I don't think that's true, but that is certainly, yeah, a trope that you hear sometimes. So yeah, and sometimes patients come with that, so.
Yeah, I do generally agree, but I don't find that's the case with this because it's
No.
such a technique. It's only it's little scars, but a large distribution of treatment.
Yeah.
You're undermining a large area, and you're with their very, very clever kit, you're able to actually access the entire width of the neck.
Like I would if it was open,
right?
But it's not. So yeah. So I don't know.
I think
it's yeah.
Described it previously to me. I think it's like a hammock for under your chin, like a hammock, permanently matched up ears, anchored behind your ears, like a big hammock. And when you think of a suture and a thread, you kind of think of this little, but it's the way it goes around, isn't it? Like that kind of shape.
Yeah, woven in like a double loop underneath, and it just, as you tighten it at the front, it just starts to engage at these very tight ligaments at the back, and then just everything comes back then. So yeah.
Like that, doesn't it?
Yeah, that's right. Yeah, under the chin. Yeah.
So it's great. Someone has asked, what's the swelling like after the procedure?
Pretty minimal because you've removed most of the fluid that you put in with your liposuction.
Right.
So actually you feel quite froggy during the procedure and that you're quite filled up, and then you have the liposuction and the tunneling, and that kind of gets rid of most of that. And then sort of by the time the garment's off for the very first time, sort of we do it 48 hours afterwards, most of that swelling has basically gone. So about 48 hours, I guess. And then I say about 6 weeks to see kind of what you want to be seeing. And then 3 months for everything to be totally settled down and you living your best life.
The same person has asked, does it feel lumpy afterwards?
It looks a bit bumpy still at 48 hours. By sort of 2 or 3 days, it's almost completely smoothed out. We've had a couple of people that have still looked a bit bumpy up to about 2 weeks. But no, and you can't really feel it. You can't feel anything in there per se. Sometimes people say like, oh, I do feel it as tight when I'm turning my head a little bit, but then that kind of just, the body kind of gets used to the new normal and it doesn't feel tight or weird anymore. But yeah, there's no real lumpiness or bumpiness, just kind of that from the swelling really, and then that just goes away. So yeah.
Brilliant. Fantastic.
It is, I've got to say, it's an impressive. I saw when we were being trained on it, the thing that was really powerful, and I thought I've got to get this in my life, and that's when I decided to introduce it. We'd gone through the surgery, and then a lady came back, and they were asking us, okay, tell us about the experience, and she was telling us how it had gone. It was all just very comfortable and very nice. And then said, okay, now have a feel, see what you can feel. And we just couldn't feel anything. Look for the scars where they should be. Couldn't see a scar. And then they said to us, when did you have your surgery? And said, yeah, so I had my surgery 10 days ago. Yeah. What is this? What is this movie?
Yeah, witchcraft.
This is incredible.
Yeah.
So, which is not the experience of open surgery at all, as you know.
No.
You do a week, would you say?
How many do I do a week?
Month.
Sadly, I am shackled to the NHS for most of the week, so I get Friday to myself, and I usually try and do 2. With training and stuff, I might do a few more if we have a training day on the Saturday then. So it would be 1 to 2 a week at the moment. So yeah, so I'm still full time in the NHS, unlike some people.
That's a good amount, though.
Yeah, it's very
That's
popular.
great.
It's very popular, and I, you know, you get people sort of coming from all around the place, you know, in the north to have, and we run Google ads and things, so it does kind of get out there, and the girls at the clinic try and do Instagram stuff on it and things like that. So yeah, and I think it's like any kind of newish surgical technique. You know, it's kind of just got to get out there to get a bit of traction.
Yeah.
And we got more plastic surgeons doing it. So yeah.
I found it the most incredible thing, because as soon as you describe it to, you know, we might be talking about it in a room, and then 5 or 6 people who you didn't think were listening, their ears will prick up. That what are you talking?
Yeah.
What is this? And everyone wants this, and they don't know it's out there. So a lot of this will be, you know, I don't think anyone over 40 who hasn't had their neck treated is totally happy with their neck.
Yeah.
It's true.
Absolutely.
Facial issues can be treated so easily and so frequently that the neck can get, you know, the neck and the hands, everyone knows, you know, your face can look great, but your neck and your hands
give you away.
It gives it away. So to finally have a treatment that addresses that area without something really invasive, it's just a game changer.
Yeah, it's very appealing to people. It's very appealing. So yeah.
Someone's just written in, I live in the northeast. How would they work with pre-care, aftercare, etc., please?
Okay, so in more general terms, if you've got a patient who's maybe a few hours away from you, because this is something that we deal with quite a lot, and I'm sure you do as well. Yeah. How do you manage?
So we normally ask people to come and stay sort of nearby for at least the 48-hour checkup, so that our nurses have had a little look at them and that they're okay. I know you have inpatient facilities, we don't, but we're very centrally based, and there's a couple of really nice hotels and stuff just nearby us, so they have access to the number to the clinic and that type of thing. If they need us, they can ring, but essentially we ask them to stay till the 48-hour check. And then they head on home, and then they have video kind of consultation with the nurses. So they'll just have a little look at the wound or the little puncture marks. And then I normally ask them to come back and see me at the 6-week mark. If they're from really far, and we've had a few people from Brighton and all sorts of places, then if they're okay, then some choose to have a video consultation. It's not kind of my preferred as a follow-up, because I like to be able to feel it and things. But, you know, they usually those ones, they're like, well, I'm totally fine, so I don't want to come up. So I'll just ring you, you know, and that's okay. But anybody's welcome anytime afterwards. You know, you just phone the clinic up and you can make an appointment, and I will endeavour to see you if there is either a problem or you need to see me or whatever. So yeah.
Yeah. Actually, you mentioned the inpatient. We do have inpatient facilities, but we wouldn't admit.
No, not
for
this. No. But yeah,
local stay at a nearby hotel. For what an overnight hospital stay costs a patient, they could stay in a really nice hotel. So I just would, because they don't need that. And
would they need to stay in a hotel, or could they just go back for a couple of days and then come back?
Oh yeah, they could leave and come back. I tend to not want people to head themselves
out.
Yeah, exactly. Too far too soon. I like to be easily on hand if they need me. Are they going to need me? Probably not. But then they're going to have to be, if you think about it, say they've traveled 3 or 4 hours, they'd be then doing that twice in 48 hours, round trip each time. It's just quite a lot.
Traveling is stressful and just tiring. So tiring.
You know, 2 nights in a hotel.
Yeah.
It's quite easy.
Easily done.
It's sometimes quite pleasant to actually be, be away from home somewhere new, be looked after, new meals in a different room. It's quite fun.
Fab.
Cool. how are we doing on the questions?
I
Have we got
think
through
we've
them?
gone through all our questions, unless there's any live ones. But yeah.
Oh my goodness! Oh, that's.
So Anoni, if people want to contact you and get in touch with you about this procedure, how do they do that?
So we've a website, the Grange Clinic, www.grangeclinic.co.uk, or we've Instagram, Grange Clinic, or me, face and neck surgeon. And yeah, people just drop a line in, and it's all our price lists are up on the website, and like what we do and how to get to us and that type of thing. So yeah, so that's how.
Perfect.
Amazing. Yeah. Or you could even come to us.
Exactly.
Down in.
Oh.
Yeah,
go visit them. Yeah, exactly, at the Berkshire Grove. Yeah, exactly. It's like
BerkshireGroveHospital.co.uk.
yeah.
Or me, _ plastic surgeon.
Berkshire Grove's easier to spell.
Yes.
Unless you're looking from on the GMC.
Yeah. 464515. That's me. I've got to say, doing this kind of thing is so much fun because I mean I don't think I'd seen you since Dallas.
I know. I said that whenever Amy was like, that's the Cynosure rep, was like, oh, would you do it at this place? And I was like, yes, I would. I'm desperate to see this, the Berkshire Grove and things, because I had seen Bex, like, was it you were just about to open the hospital, and it was at Capsco, the awards ceremony thing, and you guys were up for, or Eternal 360 were up for something, but you weren't there full view. I can't remember. You were on some body contouring malarkey somewhere nice. Yeah. And you said come to the opening, but I couldn't. We were away. And then I had Amy get, and I was like, yeah, come, but we hadn't seen each other in like years. So yeah. And then before that, of course, was Hull.
Wow. Wow. So trainees in Hull.
Like you probably barely remember that, but yeah.
No, I do. But that was, you know,
where we first met.
Yeah. So I saw Alistair Platt and Mohammed Riaz, who were in Hull, and I was chatting to them over dinner. I just said, you know, that was just an incredibly happy year of my life. And they were quite taken aback. Alistair was. And I said, no, really. I think as a trainee, that was probably the happiest year of my life.
Yeah.
And there was something about when we worked in Hull. First of all, it was a great unit. It's a great plastic surgery unit. Totally hats off to that place. And whenever I sometimes have patients requesting a consultation from, you know, the very northeast, and I say to them, you do realise that you've got some just awesome plastic surgeons on your doorstep.
I know.
So but I said it was so happy because it was a great unit. It was a really closely knit team. And one thing that I think was great in a way is that whenever you were on call, you were working at, no one lived close to Hull. We all lived in kind of Leeds or whatever. So we were all an hour away. So whenever you were working there, that's it. You were staying the night and you were just, so family knew they weren't going to see you, and that was off. So late finishes, early starts were fine because you were away from home.
You were there anyway. Yeah.
You just got an amazing amount out of the job. I just thought it was brilliant.
Yeah, and they were all just like, like dads. If you want to say, like, you know, it's like.
Oh God. I remember. You're going to know exactly which consultant I'm talking about when I tell you this anecdote. But I won't name the name.
Is it the poo story?
It's not the poo story. This was Hull, not Leeds. And it was about my first or second day of the job, and he wandered into theatre while I was operating, and then between cases, he took me outside and he said, "So, Mr. Urso Bayada," and he always called me Mr. Urso Bayada. So, Mr. Urso Bayada, I need to ensure that I'm happy to entrust the care of my patients to your hand. And he started grilling me. He started like full on Graben Smith, taking me through the whole textbook.
Please don't hurt me.
I think I was a year 2 registrar.
Do you know who that is, Anoni?
I do. Sadly, he's no longer.
Indeed.
no longer with us. Yeah, but yeah, he probably offered you a cigarette though, if we're honest.
Yeah, he also got me to inject his
I
gout between cases.
injected his knee
6 months.
too.
Did you do that too?
Oh, that's hilarious.
Yeah. Oh, do I have
Dear. Yeah, he
Great that
was
you
a good man. And yeah, it was yeah, he was a special person, a very good surgeon, very good melanoma surgeon.
Great
And yeah,
and a
it
real
was great.
character. They talk about personalities of certain. I think they used to sort of talk about a bygone era of really idiosyncratic personalities, but I don't think it's a bygone era at all. I think we just develop into our eccentricities as we get older.
Yeah.
So I definitely have mine now that I don't think I used to quite so much.
Yeah.
Yeah. You get into your own groove, really, don't you? It's like it's just how it is, and I try and keep it as peaceful as possible.
Yes.
Yeah.
We always have a good day.
Right. Oh, and Noni, look, it's been absolutely lovely. It's been a joy chatting to you tonight. Thank you so much for joining us. I think we're done on questions.
I think we are.
So
yeah, and I need to get a few bits sorted out tonight. So yeah.
Cool.
Mm.
Okay, well.
And you need to enjoy your holiday.
Well, yeah. Thank you. Well, thank you so much. What we're going to do is chop this up into little videos, and we will share them with you on YouTube, and you can use them. And you know, they'll be on little topics.
We have
so
a YouTube channel, so probably we'll get them up there on there as well. So that's cool.
We'll get those over. Amazing. Thank you so much.
Lovely
Lovely
to
seeing
see
you. And
really enjoyed it. This is my first ever live. So yeah, really.
Oh,
I've never done it before. Yeah. I messaged before and I was like, I have no idea how to get on this, please help. And then I thought, oh, it'll be fine, whatever. So yeah. But
amazing.
Nice and relaxed and easy, hey?
Yeah, indeed. Yeah, it's not too bad. It's just like I could talk about plastic surgery till the cows come home. So
I know. That's my problem. I need this one to sort of get the hook.
Right, we're done.
All right.
Yeah. All right. And on that note.
All right.
Thanks so much,
Bye,
guys.
Anoni, and thanks
So
again.
nice to see you. Enjoy your holiday. Take care. Bye-bye.
Thank you.
Bye.
Bye.
Thanks.